Practice Doc and CEO of Clinnovations LLC. We're an advisory consulting firm working with and the federal and state governments around T. I'm also a member of Ozmosis.
Okay. So what is the most important change that you want to come out of healthcare reform, out of this healthcare reform?
So I think there are a couple of things that are really important, and I don't expect health reform now to be all-encompassing. I do think that the opportunity for patients to always have access to insurance, and whether that's removing any barriers around pre-existing conditions, making sure that the portability of information across state lines and competition for patients is going to be really important. So the second thing that I think is really important, I think there's an opportunity, I think it's Senator Barrasso, who's out of Wyoming, has talked about patient accountability. I would love to see that as a part of health reform and the ability to incentivize patients to stay healthier. I think there's a real opportunity for our country to do that.
What do you see healthcare IT or health IT as? What ultimate role do you see it playing in healthcare reform?
So I think the foundation of health IT and where it can impact health reform is around the quality of healthcare and really the sharing of information. So I think there's a lot that's going on right now to help fund both hospitals and ambulatory practices, individual physicians around healthcare IT, and enabling providers to share information and to improve quality, then actually to be reimbursed for that, I think is a fundamental part of health IT and how it will impact health reform.
Okay. And do you think that the current incentives that are offered by the government are enough to drive healthcare adoption?
I think if you split it out, I think from the hospital side and what we're seeing certainly in the industry is that every hospital system that we work with or talk to has accelerated their efforts around healthcare IT. And part of that certainly is related to ARA and to the stimulus. When you look at ambulatory practices, I believe that it's a partial step, and I think big practices certainly are moving that way, and I think the difficult part is the infrastructure for those ambulatory practices, and is there enough really to help them? Are the vendors going to be too spread out? And I think we haven't seen yet what the regional extension centers are going to do and how they're going to play a role. Right now it seems that they all have sort of a different mindset and a little disorganized, so I'll be interested to see how it's going to play out.
Great. And then the last question is, what do you think about the concept of the patient-centered medical home, and do you think it has the ability to help improve patient care and drive down costs?
I certainly do. I think the patient-centered medical home is a great opportunity as you look at sort of multidisciplinary care as well as the patient as a part of that care. I think technology can enable that, and I think we're at a point, especially with a lack of total primary care providers around the country, about the opportunity to leverage different groups. So I think the opportunity to leverage technology to look at how different groups, from ancillary providers, from how the hospital weighs in, and how our clinicians and the patient can be at the center of that is going to be really important. I do think that the regular doc, a family practice doc like myself, is going to need some help though in doing that.
You're ready.
Okay. Hi, I'm Roger Westfall. I'm a family physician practicing in Front Royal, Virginia. I've been here for the last 28 years, and I'm a member of Ozmosis.
Great. And what do you think of what's going on in healthcare reform today?
That's a difficult question, and because I really haven't spent a lot of time studying the proposals, the different bills, the things that have been put before the legislature. I think one of the things that I feel with healthcare reform that we need to be most important is maintaining the physician-patient relationship, which is something that medicine's been built on for years, and I think it's something that we need to maintain, and trying to keep the patients with their doctor that they seek.
Great. And what do you think about the concept of the personal medical home?
The personal medical home is something that I feel as family physicians that we've been doing for years. The patient medical home, patient-centered medical home, makes me think of being patient-centered care, which involves care that's centered on the patient, and so that's something that I feel we've been doing all along. There's some newer techniques to try to make that more beneficial to the patient, and I think those are good. But I think family practice is well suited to that and will not really need to change much from what it's doing right now to have a patient-centered medical home.
I'm Frank Dennehy, a family physician and the residency director at the Shenandoah Valley Family Practice Residency Program, a VCU program, here in Front Royal, Virginia, and also a member of Ozmosis.
Okay. So what do you think is the most important thing that could come out of this healthcare reform?
Measures to improve the workforce, hopefully without disrupting the doctor-patient relationship.
Okay. And what do you think about the patient-centered medical home?
Most of us in family medicine have been doing the patient-centered medical home our whole careers. I am concerned that the idea is being hijacked somewhat as it's being implemented and developed. So it's a great idea. In its implementation, I have some concerns.